Hi, my name is Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. She's sitting in her office. The roads are terrible. Thank you for getting there on what many people have as a holiday. We're looking ahead to tomorrow, where a lot of places have already called off and said they won't be open. Tell me the situation with CUPHD.
Well, so far, I mean, are planning, both us and Carl. Hold on a minute, let me call up my little press release here. But we are planning on doing the vaccine clinics tomorrow. So, but we do want people to understand that if for whatever reason you can't get in or you're not comfortable coming in for your second dose or for your appointment, please just let us know and we will get you rescheduled toward the end of the week when the weather is hopefully better. So we're not going to give away your shot or anything like that. So if you need to reschedule, you can give us a call. If you're at the Rantoul Youth Center, you can call 892-6844. If you're scheduled at the Dress Barn Clinic tomorrow, you can call 902-6100. Or if you're scheduled at the CUPHD clinic or the iHotel clinics, you can call 531-4538. So those are the ways to get in touch with us if you need to reschedule. Otherwise, unless you hear something, tomorrow in the media, plan that we will be there and we will be vaccinating.
Okay, so speaking of vaccinations, last time you and I talked, it was 65 and up with existing conditions. And now have we moved into the 40 and up with pre-existing conditions, or where are we?
We're now in 40 and up with pre-existing underlying health conditions. So if you fit into that category, please call and get scheduled as soon as you can. We will keep opening clinics every week for that group until we feel like, the people are getting vaccinated, so we're not seeing such the need. And then we will open it up probably, 16 and up with underlying health conditions. So if you fit in that category, please go ahead and get scheduled for that. I'm super happy with how fast people are signing up and getting vaccinated. That's going to help a lot.
My parents just got their second dose, thanks to our friends at Carl out at the old Dress Barn. My question for you is, I haven't been vaccinated yet. Their grandchild hasn't been vaccinated because he's under 16. Even though they have double doses now, what does that mean in terms of moving around and visiting with family?
They should still wear a mask when they're visiting, because they could still potentially pass it on to others who are not vaccinated. But yes, it's definitely makes it a lot safer for people to visit family. And in fact, I got to visit my little babies in my life this weekend, and I was absolutely ecstatic about it. Some of my babies.
Mental health is also part of this in terms of recovery. Let's talk about the doses that have been allocated to 6,500 pharmacies, including CVS, Walgreens, and Walmart. How does that work? Do you need an appointment? Are we at the walk-in stage yet? Do you know how they're handling it?
We are not at the walk-in stage yet. They each have their own system for making an appointment, and as far as I know, they're all online. So it's not user friendly for everyone, certainly, but they do have, some of them are open. As far as I know, the only one open around here is still the one in Mahomet, the Walgreens in Mahomet. But we are working now, we have to work with the state because we're finding out that the pharmacies are not holding back the second dose and people are having difficulty getting the second dose. So, those numbers do not go into our planning. And so we're going to have to work something out where they have to change their ways a bit.
I'm glad you brought up numbers. It's time to review where we are with hospitalizations, deaths, and recoveries.
Okay, so right now we have 719 active cases. And of course, we expected those to go up because the U of I is back in. We have 926 in quarantine. We have 17 currently hospitalized from Champaign County. We have had 123 deaths. That has gone up quite a bit. And we have our county positivity rate, our county positivity rate is 3.8%. The super exciting news is, as of yesterday, our vaccine numbers were 52,668 first vaccines, and 11,739 have been fully vaccinated. That's 6.79% of our county. And of course, second doses are going out today, and they will go out all week as well. So we are very happy with the way that is going. So we just urge people to, help others who may need help getting to the sites. If you know someone who needs a vaccine and are hesitant, talk to them, have them talk to someone to get questions answered. We want people to be comfortable, but we also want people to get vaccinated.
That's very encouraging that our percentages are under 4% and that so many people have been vaccinated. The number I want to ask you about, the percentage, is that according to the CDC, particles are blocked 92% of the time if you double mask. Admittedly, I have not gone that way yet with the double mask. Do you recommend that protocol?
Well, it is being recommended now, and especially for people that are at risk. But you can just take one of the little surgical masks or the paper masks, and those are really plentiful now. They used to be hard to get, but they're selling them everywhere. Even some places have individually little wrapped ones, which I think are nice. I threw some in my car in case somebody needed one. But so you can just wear the little surgical mask or paper mask underneath a regular mask. But the main thing is just that it is, tight fitting. It's not gaping around your face. Make sure that it's tight fitting, covers your nose and your mouth all the way, and still remains 6 feet away from people.
We've had some schools open up in a hybrid situation. According to the CDC, the guidelines for opening schools focus on 5 key COVID mitigation strategies: the universal and correct wearing of masks, physical distancing, washing hands, cleaning facilities, and improving ventilation, and contact tracing. If one or two of those is not properly followed, does that mean that it's just not worth it to open the schools? Do all 5 of those have to be in place in order to be effective?
All 5 of those really need to be in place. Everybody's already doing the cleaning and things like that. We've got the contact tracing covered at Public Health. There is no shortage of that in our county at all, but that is the case in some places. So really what the schools have to concentrate on and the parents are the proper masking, which, kids do a pretty darn good job of that. And we're finding that kids really do put the masks on and not really have an issue with it. So masking. And the main thing that schools have to do are keep the kids 6 foot apart. Make sure the desks are 6 foot apart. If they're not, and you get a case in there, you're going to have a lot of kids that have to quarantine. And it makes, parents angry. It makes school staff irritated, so if you cannot do that, you have to figure out, if you can't do it in your regular classrooms, you have to figure out a way to do it, whether it's staggering the schedule so that not all the kids are in there at once. But it is key. Masking and distancing are the key. And of course, schools do a pretty decent job of hand washing and everything too, but keep that up as well.
What percentage of people take the vaccine that will make you comfortable? Is the number still 70% of the community of the country?
It's still not 100% known, but yeah, it needs to really be up there, because if not, and if we don't see that in our country, what we're going to see is just the vaccine or the virus just hanging around, continuing to mutate, and what we're of course concerned about would be that it would change in a way that would make it go beyond the vaccine, so the vaccine wouldn't work anymore. And then we'll have to do boosters, or they'll have to tweak the vaccine somewhat. But it's important that everyone, take it seriously. We're a year in, and still people, we're almost to 500,000 deaths, which no one should find that acceptable at all, because it was preventable, and no one should find that acceptable. And yet people are still, downplaying it, and it's clearly it's nothing to downplay.
Dr. Fauci says that by the end of the summer, hopefully everyone who wants a vaccination will be able to get one. Mm-hmm. Once that happens, after that, how much longer will we be in these mitigation efforts with the washing our hands and socially distancing? How long will we have to wear a mask? Is that known?
I don't think it's really known yet, but if there's, a high percentage of people vaccinated, then of course we're going to get into the situation where the people that are vaccinated are covered and the people that aren't are not, and you're still going to just keep having cases. It won't be as bad, and it hopefully will, the more people vaccinated, the less likely you are to overwhelm your healthcare system. So that's key.
Anybody that wants to compare COVID to, it's just the flu, as you and I both have heard that hundreds of times, the flu has dropped. We are keeping ourselves away from each other. So that's an added bonus, isn't it, this year, that other viruses don't have hosts to jump from one to another.
Yeah, it's definitely helped with that. The distancing, we had a decent uptake of flu vaccine in our community this year in our county. So we have that, plus the staying distance, the wearing the mask, that always helps. We've never done it with flu before since 1918, pretty much, probably, but it does work. I'm wondering if every winter I might just not wear a mask when I go out, because I have really enjoyed not being sick for the last year, knock wood. That's been kind of nice. So it's just something that it's not that big of a deal. And if I fly, I'll probably wear a mask for the rest of my life, because I usually pick something up on a plane. So between the mask wearing and the hand washing, that probably will help cut down on it some.
And the variant, that helps cut down on everything, but have we seen an increase in the variant, or are we holding steady at that number right now?
I don't know the exact number right now, but we're in the 20s of cases of the variant found. It's hard telling how many different kinds of variants are out there. There's just, we're just not doing a good job yet. We are starting to, but we were not doing a good job in the US looking for them at all. So I'm sure that, there's variants of all kinds out there. What you don't want is for them to just keep spreading and then become the dominant strain. I think we've seen where places where that has happened, where the UK variant, for example, so much more infectious, they're under basic lockdown in the UK right now.
Okay, Julie Pryde, again, if you could go over who is eligible to sign up for vaccines now, and people should follow the media in terms of any changes in the schedule due to weather or anything. But if you wouldn't mind just telling us once again who is eligible.
Sure. So if anyone who's already been eligible continues to be eligible. So if you're a healthcare worker, you work in long-term care, you're a therapist, you do anything like that, a dentist and dental hygienist, and you didn't take it before for whatever reason, you are still eligible, and you can call public health 531-4538 to get scheduled for that, or you can call out to the Carl location, which is at the Dress Barn up by the mall, and that's 902-6100. Same thing with if you are anyone, basically right now, anyone 65 and up, regardless, should be eligible. You are eligible. So if you have not been vaccinated, please get vaccinated. And then if you are 40 and up with underlying health conditions, you're eligible. If you work at a grocery store, you're eligible. If you work in manufacturing, you're eligible, regardless of your ages or your health. If you work in, or you're a first responder, all those different categories, even if you've didn't want it to begin with, but now you've changed your mind, please go ahead and get yourself scheduled and get in.
Okay, Jason Liggett, our wonderful producer with UPTV, thank you for continuing to edit and make us sound good each week. I want to thank Urbana Mayor Diane Marlin. She has been a very gracious host of this information. And Julie Pryde, you look good. You look rested. So I don't knock on wood on that too. But CU PhD, thank you so much for being here today.